I'm Dr. Emerson, and on behalf of the orthopedic surgeons, clinical, and support staff, we want to welcome you to the Cottage Center for Orthopedics. Our total joint program is nationally recognized for advanced orthopedic medical care and has earned the Joint Commission's Gold Seal of Approval for advanced certification for total hip and total knee replacement. Every 2 years, Goleta Valley Cottage Hospital and Santa Barbara Cottage Hospital complete rigorous on-site reviews to ensure compliance with the most advanced total joint care standards. This attention to quality and excellent outcomes is something we are proud to share with you. To understand your procedure and what's required for it, we ask that you and your support person or coach read the Total Joint Patient Guide in the weeks before your surgery, because certain requirements must be met 7 days prior to the surgery. You and your support person also need to watch the required core educational videos. This is an important step for your safety and to help prepare for surgery and recovery. Your hip joint is located where the thigh bone, also known as the femur, meets the pelvic bone. The hip joint is referred to as a ball and socket joint, where the femur forms into a ball that fits in the socket of your pelvic bone. In a healthy joint, there is a lubricated layer of cartilage that covers the ball and allows for easy, pain-free movement. Although there are different reasons to replace a hip joint, the most common is osteoarthritis. This is the loss of healthy cartilage, and this causes thinning and irregularities in the surface where the two bones meet. This leads to pain and limitations in function and movement. During a total hip replacement, we remove the diseased ball and replace that with a new ball, typically made out of ceramic or metal. That ball is held in place on a stem that goes down inside the hollow thigh bone. Inside the pelvis, we resurface the socket with a new titanium shell, and that also has a smooth, polished liner. That allows for smooth-on-smooth motion, as opposed to the two previous bones grinding against each other. The goal of a hip replacement is to restore its function and to alleviate pain. Your surgeon will discuss the specifics of your diagnosis and surgery with you and answer any questions you may have. Our goal with a total hip or knee replacement is for you to be able to return home, typically the next morning. With planning, some patients may be able to go home the same day as surgery if all discharge criteria are met. Patients discharged to home with some short-term assistance have fewer complications and faster recoveries. Please arrange for a support person to stay with you for at least a few days after you go home, just to make sure you're well on the road to recovery. Thank you for choosing Cottage Center for Orthopedics. We look forward to caring for you through your total hip replacement and helping you to return to the activities you enjoy.